This video is a brief introduction to psychological trauma as explained by me, Dr. T. Hi, I'm Dr. T. Today I'd like to talk to you about psychological trauma, or what I just call trauma. What does trauma look like? What are its effects? If you've thought at all about psychological trauma, maybe you've thought about things like military combat stress or natural disasters. Maybe you've heard of post-traumatic stress disorder or PTSD and wondered, is this trauma? Or is there more to it than that? In this video, I'd like to talk to you about the fact that, in my opinion, trauma is much bigger than PTSD and much bigger and more common than things like military combat and natural disasters. In fact, trauma can affect anyone and probably does affect everyone at some point in their life. The difference between whether a trauma affects you greatly or not at all depends on your experience of the trauma. We'll talk about things like bullying and child abuse and how these things are truly traumatic events that can affect a person for the rest of their life. We'll talk about the various things that can happen to you after you've suffered from trauma and how these things can be long-lasting and sometimes can take your life. After this video, hopefully you'll have a better understanding of what trauma is, and maybe you'll recognize yourself in having had a traumatic experience or in having suffered from the effects of trauma. In other videos, we'll talk about how you heal from trauma and the things you need to do to have a better life, even after being victimized by the experience of trauma. In this section, we'll talk about what can we call trauma. As you can see, there's a long list of things you can call trauma. Bullying. Bullying is a deliberate and unsolicited action that occurs with the intent of inflicting social, emotional, physical, and/or psychological harm to someone who often is perceived as being less powerful. It can happen to anyone at any age. Community violence. Community violence is exposure to intentional acts of interpersonal violence committed in public areas by individuals who are not intimately related to the victim. Examples include things like gun violence, rioting, and physical or sexual assaults. Complex trauma. Complex trauma describes both children's exposure to multiple traumatic events, often of an invasive interpersonal nature, and the wide-ranging long-term effects of this exposure. Many cases of child abuse lead to trauma symptoms in childhood and adults alike after they've experienced this kind of trauma. Disasters. Natural disasters include hurricanes, earthquakes, tornadoes, wildfires, tsunamis, and floods, as well as extreme weather events such as blizzards, droughts, extreme heat, and windstorms. This is what a lot of people think of besides military trauma when they think of PTSD and trauma. Early childhood trauma. Early childhood trauma generally refers to the traumatic experiences that occur to children aged 0 to 6 years of age. This is often what we now call developmental trauma. Military trauma. This is sometimes known as shell shock or combat stress. It occurs after you experience severe trauma or a life-threatening event as part of being in the military and being exposed to chronic or severe military violence. This is what doctors first called PTSD or post-traumatic stress disorder. Medical trauma. Pediatric medical trauma stress refers to a set of psychological and physiological responses of children and their families to single or multiple medical events. Traumatic grief. While many children and some adults adjust well after a death, other children have ongoing difficulties that interfere with everyday life and make it very difficult to recall positive memories of their loved ones. Terrorism and violence. Families and children may be profoundly affected by mass violence, such as acts of terrorism or community trauma in the form of shootings, bombings, or other types of attacks. This is what's seen after school shootings and similar types of unexpected, large-scale attacks. Physical abuse. Physical abuse occurs when a parent or caregiver commits an act that results in physical injury to a child or adolescent. This often overlaps with other types of trauma. Refugee trauma. Many refugees, especially children, have experienced trauma related to war or persecution that may affect their mental and physical health long after the events have occurred. This is very common and affects all ages of refugees from all parts of the world. Sexual abuse. Sexual abuse is any interaction between a child and an adult or another child in which the child is used for the sexual stimulation of the perpetrator or an observer. Trauma and PTSD are not always the same thing. I really want you to realize that most medical and psychiatric doctors call all cases of trauma PTSD. And yet, if you've had an experience of trauma in your life, you may see that what are described as the typical symptoms of PTSD do not apply to you. This is because modern doctors have a very narrow view of trauma and often do not recognize it unless a person has the typical symptoms seen in classical PTSD. Let's take a look at what doctors call classical PTSD symptoms. There are 4 different categories they look for. They look for at least one intrusion symptom: nightmares, flashbacks, emotional distress, unwanted thoughts, or feeling physically activated when reminded of the trauma. At least one avoidance symptom. These are trauma-related thoughts, feelings, or frequent experiences of being reminded of the traumatic event or events. At least one negative mood or thought symptom. This includes poor memories of the event, a negative worldview, having feelings of blame or isolation, or having feelings of low mood. At least one arousal symptom. These include things like irritability, poor sleep, being easily startled, poor concentration, risky or destructive behaviors, or hypervigilance. One of each category is required for at least a month. And one more thing. According to the way the diagnosis of PTSD is set up, your doctor can't diagnose PTSD unless you have a known incident that was life-threatening, either experienced by yourself or witnessed by you. In my opinion, this narrow view of PTSD excludes a lot of people who have a different experience of trauma or who have had a known or unremembered trauma that affects them differently than is seen in classical PTSD. So essentially, PTSD is just the tip of the iceberg of trauma. What most people see is PTSD. What they don't see are all the other trauma-related disorders that are the effect of severe trauma that don't necessarily look a lot like PTSD. If there's one thing I want you to take away from this video is that trauma is not a mental disorder. You need to stop thinking about trauma and PTSD as mental disorders or a personal weakness. Your experience of trauma affected your brain, body, and mind in deep and long-lasting ways. Your body and brain adapted to help you survive, and they often cannot tell yet that the war is over. This is what trauma healing teaches you. Let's look at how trauma can affect your whole life. If you've experienced trauma in your life, you are 4 times more likely to become an alcoholic. You are 4 times more likely to catch a sexually transmitted disease. You are 4 times more likely to inject illicit drugs. You are 3 times more likely to take an antidepressant in your lifetime. There's more. If you've experienced trauma, you are 3 times more likely to have problems with work absenteeism. You are 15 times more likely to commit suicide. You are 2.5 times more likely to abuse tobacco products. You are 3 times more likely to be depressed. And you are 3 times more likely to have serious work difficulties in your life as a result of trauma. Trauma can have major effects on your physical health. There is a known increased risk of these diseases after an experience of trauma. Cancer, heart disease, chronic lung disease, obesity, fibromyalgia, irritable bowel syndrome, autoimmune diseases, and diseases caused by risky behaviors like sexually transmitted diseases, accidental injuries, and unintentional pregnancies. So all this might lead you to say, I am a trauma survivor. Am I doomed because of this? No, you are not doomed at all. But you also cannot just sit back and let the trauma you've experienced ruin your life forever or even take your life. Healing is possible, but it takes work. It will involve efforts by you to heal your mind, body, and spirit or soul. Missing this trifecta of the trauma experience and failing to address each of these parts of you means you will not live your best life. So this leaves us with two basic questions. How do I proceed? How can I heal? Is it possible? First, decide to do something today. Start your healing journey or find a new path on the journey you are already on. The path to healing is not linear. You can start and pause at any time, and you can go on more than one road at the same time. Healing is also not steady. There will be hiccups along the way. Just don't give up, ever. Thanks for listening to my video. I'll talk more about trauma in other videos to come. Bye.